Hi, welcome back. So this video is discussing quick tips to cope with some chronic pain syndromes. One thing to note is you need to stay active. So exercise is shown to decrease stress and anxiety levels by releasing endorphins to make you feel better. And a lot of times with chronic pain, you have fear avoidance. So you don't want to do the activities that you normally do out of fear of increasing your pain levels. So you can't let this pain take over your life. So maybe back off a little bit, don't go run a marathon. But it's important to stay active and not let your body get into the muscle memory, quote unquote, of doing things or not doing things and exercising. Like we talked about in the previous video, it's not good to, avoid things altogether and stay inactive just because you don't feel good, even though that is much easier said than done. With that, like I said, knowing your limits is important. So you can continue to be active, but understand your limitations. Make a plan on how you're going to manage this pain once you're done, or preventing it from happening in the first place. It's important to stay social and make social connections. Talk to family members, talk to friends. There's a lot of research that show that people with a bigger support system are more resilient and less likely to experience depression and anxiety in conjunction with chronic pain, as well as having less subjective pain in relation to that. With that, it's good to distract yourself when pain flares up. Engaging in a hobby, going outside, visiting a museum, doing something to distract you from that, because the more we dwell on it, a lot of the times the more we notice the pain. With that, not losing hope is important, and again, that's easier said than done, but there's a lot of psychological treatment, going to see a psychiatrist or a psychologist or a therapist. They can give you better methods to understand what's happening in your brain better than I can, and talking through it and maybe finding some other coping mechanisms in addition to some of these in this video series. Another thing to note is to follow your prescriptions very carefully. So if you are prescribed pain medication, it's important to abide by the prescription guidelines and not to overdose yourself. Sometimes that can be very fatal. Another thing to note with pain medications is a lot of the times the body has a very high adaptation to it, so your body will get used to it. It's not good to rely exclusively on pain medications and other over-the-counter pain management techniques, because this is putting a band-aid on the problem and not fixing it or learning other coping mechanisms. Obviously, it's okay to use these, but it can't be your only method of treating yourself. So that's kind of a few quick tips to keep in mind when you're dealing with chronic pain symptoms, and that it's okay to still live your life and not keep your body just at home under wraps.